This past summer on June 9th, BMJ Mental Health, a scientific academic journal, published a groundbreaking study directly linking intimate partner violence, or IPV, with lasting brain injuries and adverse mental health effects. One of the co authors of this study is esteemed Ohio University professor Dr. Graciela Muniz-Terrera. Dr. Muniz-Terrera works in the Heritage College of Osteopathic Medicine here at OU, mainly focusing on health and aging in her office at Irvine Hall. She also just retired from the University of Edinburgh in Scotland.
I have an interest in women's health, right?
Mhm.
And it's something that many aspects of women's health is ignored, completely neglected once that person has passed reproductive age.
There is a current lack of research in the area of long term mental health effects when it comes to dealing with IPV cases. Dr. Muniz-Terrera, along with five other doctors and scientists from institutions in the UK and France, noticed this problem and took action. After contacting the Drake Foundation, a nonprofit focusing on brain injury research, for funding, they used data provided by Prevent Dementia UK, a mental health case study database out of the United Kingdom, to directly link IPV cases, mostly in women, with mental health problems later in life, the onset of which not occurring for 27 years after the violent relationship in some instances.
Domestic violence is something that, or intrapartner violence is something that permeates every layer of society. We could look back and say, well, what is the story behind these women? Right? How can we help them? Because that's the type of thing that you could perhaps address the issues that.
The initial study is not the last of their work, though. Dr. Muniz-Terrera and her team are exploring options to move the project forward into new areas of trauma research.
And we have some initiated the process already, looking into other outcomes too, right? Because we like the outcomes that we looked at are, PTSD, symptomatology, anxiety, depression, and so on. But one of the aspects that we want to get into is dementia risk.
It could be some time before the updated study is published, but until then, Dr. Muniz-Terrera will be working on local aging studies. This has been a Spotlight on Research with Dr. Graciela Muniz-Terrera. Reporting in Athens, I'm Dan Gray.